Climate change is making hundreds of diseases much worse. More is studied that climate change has exacerbated more than 200 infectious diseases and dozens of non-transmissible conditions, such as poisonous snake bites, according to an analysis. 1. Climate hazards bring people and disease-causing organisms closer together, leading to a rise in cases. Global warming can also make some conditions more severe and affect how well people fight off infections. Most studies on the associations between climate change and disease have focused on specific pathogens, transmission methods, or the effects of one type of extreme weather. B10 Climate change-induced hazards, including surging temperatures, sea level rise and droughts, have affected all documented infectious diseases. These include infections spread or triggered by bacteria, viruses, animals, fungi, and plants. The study was published in Nature Climate Change on August 8. The study quantifies the many ways in which climate change affects human diseases. We are going to be under the constant umbrella of this serious threat for the rest of our lives. The researchers discovered that climate change has aggravated 218, or 58%, of the 375 infectious diseases listed in the Global Infectious Diseases and Epidemiology Network and the U.S. Centers for Disease Control and Prevention's National Notifiable Diseases Surveillance System. The total rises to 277 when including non-transmissible conditions, such as asthma and poisonous snake or insect bites. The team also identified 9 diseases that are diminished by climate change. Many studies examine transmissible diseases because the conditions can transfer between people and are, therefore, feared the most. Worsening non-communicable illnesses, such as asthma outbreaks caused by increased levels of plant and fungal allergens because of global warming. Those allergens are still pathogens, biological agents that cause harm to the human body. But nobody's paying attention to them. Increases in temperature and rainfall, for instance, have expanded the range of mosquitoes and contributed to outbreaks of dengue fever, chikungunya, and malaria. At the same time, heat waves draw more people to water-related activities, leading to a rise in cases of waterborne illnesses, such as gastroenteritis. Storms, sea level rise and floods force people to move and have been implicated in outbreaks of Lassa fever, cholera, and typhoid fever. Climate threats have also made some pathogens more virulent or boosted their transmission. For example, high temperatures increase the survival and biting rates of mosquitoes carrying West Nile virus. Furthermore, these hazards weaken people's ability to cope with infections through factors such as mental stress, lowered immunity, and malnutrition. There are even more diseases known to be influenced by climate change. And the effects of climate change on diseases are even broader than the study reveals. For instance, changing environmental conditions are harming healthcare access, food security, and other health outcomes. There is no part of global health that climate change isn't reshaping. This information is authentic and purely based on scientific research. SciTips YouTube channel is your daily dose of knowledge, entertainment, and motivation. So don't forget to subscribe and share the video with your friends and family on Facebook and WhatsApp.